Back in December, Democrats warned that millions of people would no longer be able to afford health insurance if Congress let ACA subsidies expire. Well, they were right. New government data shows that about 3 million fewer people in the U.S. have health insurance plans through the ACA than they did 1 year ago. The report compared enrollment from February this year to the same time last year. Joining us, MS Now senior medical analyst Dr. Gupta and senior national correspondent at The Bulwark and author of The 10-Year War, Obamacare, and The Unfinished Crusade for Universal Coverage, Jonathan Cohn. Is this because they just don't like their health care, John, and maybe they got private insurance, or is it something else?
No, this, as you say, this is the least surprising thing ever. They took the Trump administration and Republicans in the Congress refused to extend that extra money that was available that was making health insurance cheaper. So health insurance got more expensive for more than 20 million Americans. And guess what? A bunch of people said, it's now it costs too much. I'm not going to get insurance anymore. Now, some of these people have found alternative sources of coverage. A lot of them have just ended up uninsured. And they're real people. There are stories everywhere in the local news. If you talk to brokers, I've spoken to brokers in Georgia, which is one of the states where we saw these numbers early. And I remember one broker told me she's got clients who are either they're older, they're debating, should I go without insurance? Can I afford this? Should I switch into one of these kind of flimsy plans you can buy on the kind of gray market that don't cover everything? I mean, this is a real impact on real people.
So, Dr. Gupta, are you seeing the consequences of this in the hospital?
Yeah, of course, Katie. This is not new, unfortunately. It's just gotten a lot worse. People are underinsured or uninsured. And what do we see in the hospital, in the emergency room, just a few floors down from where I'm at? We see people presenting late in the course of a preventable illness, and it results in complications, and they see somebody like me. So this has real, as Jonathan just pointed out, this has real impacts on real people. And I think we actually have just a few tips, Katie, if we have a moment for your viewers. If you are suffering, if your family is suffering without lack of adequate, affordable health insurance, what can you do? Just very quickly, few things that you can do. You can go to healthcare.gov and potentially switch to a different type of plan, Katie, that has lower monthly premiums, higher deductible. There's a trade-off. You can go to a federally qualified health clinic. Katie, these actually provide care in many zip codes across the country. People don't know about them, and they charge you based on your ability to pay. Incredible institutions cover California, New Mexico, New York. These are entities. They have healthcare safety nets that provide subsidies for basic primary care, especially preventive screening. That's something to look at. And then lastly, Medicaid. If you have a very fluctuating income, Katie, across the year, Medicaid, you can enroll at any point in time. Something to consider, are you Medicaid eligible? And then look for these new types of pharmacy options like GoodRx discounts if you're on chronic medications.
Well, that is good. That is good to have those tips. Thank you for that, Dr. Gupta. Is Obamacare going to survive this, Jonathan?
Yeah, it's going to survive. I mean, basically, we're reverting to what it was before Biden took office. I mean, you remember it was never perfect. It was always a big step forward from where we were in 2010. Lots of people got insurance. Lots of people were able to get Medicaid. But we knew for years there were a lot of people who still couldn't afford coverage. The Biden administration came in. They threw in this extra money to the program, and we saw so many more people get enrolled, and we got to the lowest number of uninsured ever. The Trump administration said, nope, we don't want to spend that money. Republican Congress, we don't want to spend that money. We can do, however many billions and tens of billions for war, but we can't do $25 billion a year for healthcare subsidies. So we're going to revert back to that, and more people will suffer. But the architecture is still there. There are still lots of people benefiting from it. And the conversation is, if Democrats get more control over Congress or some enlightened Republicans change their mind, can you go back, can you restore that money and then continue to build onto that and get to the eventual dream they all want to get to, which is some kind of truly universal system?
What does the medical establishment want, Dr. Gupta? I mean, I know a lot of doctors, and they are very unhappy with the American medical system. They say the insurance paperwork and denials are overwhelming and demoralizing. Just the way that hospitals are run. I hear a lot of complaints from my friends who want to leave the field entirely or move to another country and become doctors in, even far-flung places around the world, over practicing here in the United States. So what does the medical community need?
Well, first of all, we need an advocate. Unfortunately, Katie, I'm sure you've heard this from your doctor friends. There isn't actually one single entity or advocate. Certainly, it's not the federal government. It actually has the back of providers, whether they're doctors, nurses, you name it. Short of unions, there really isn't anybody else advocating for the needs and response and for our scope of practice. And I'd say this is for any healthcare provider. Number two, no one's really talking about the public option. Doctors want, other providers want patients to have access to a basic set of healthcare services, and that's the public option. And we've lost the plot here as a country. We don't talk enough about that. We'd like to see some version of a policy that promotes that. AMA and other entities do not talk about that because they have a lot of conflicting interests. And so that's driving a lot of angst and frustration. And lastly, you pointed it out. There's PBMs, there's insurance companies, hospitals are run as corporations. We have too many middlemen, too many middle entities getting between us and our patients.
Dr. Van Gupta and Jonathan Cohn, thank you guys. I appreciate it. And that is going to do it for me today on this Monday. Deadline White House starts after a quick break.